I'm David Rees, Assembly Member and Chair of the National Assembly for Wales's Health and Social Care Committee. And today we have Kerry-Ann O'Connor, who's one of our patients discussing in our forum, and Gwenllian Griffiths, who represents one of the organisations that supports patients in our cancer care delivery plan. So if I can hand over to Kerry as to explain what we've been doing today.
Yes, we've been talking today about diagnosis, with which they feel is very important, early diagnosis with doctors to take note of actually what is going on with you. So research and things can be notified quicker, so you can get hospital appointments, so they can get on with what is needed to be found out, to find out for your biopsies, to be bringing things forward rather than later. Kerry-Ann
has been one of the patients who's given us her experiences of the care and treatment she's received as a patient in our inquiry into the cancer delivery plan. We also have Gwenllian, who represents one of the organisations that supports patients.
Yeah, it's been fascinating for me to be here today, to listen to what patients have got to say about the cancer delivery plan. At Macmillan, one of the things we think is vitally important is that the cancer delivery plan, which the government brought in a couple of years ago, actually gets implemented, because it's such a positive step in the development of cancer policy in Wales. But now obviously we need to make sure that the focus is on implementation, and what better way to find that out than listening to patients. So it's great that we've had the opportunity today to listen to patients from all over Wales, talk about the different experiences, what's good about cancer care in Wales, but also areas where we need to see progress faster.
The committee has listened to a variety of patients today, and we have prepared now our questions for the next set of sessions. Our focus is on examining the professionals, the health boards and the Minister and the Welsh Government as to what they're now going to do with the plan and how we can address the issues that have been raised today. Following that, we will produce a report, and then we will ask the Welsh Government to respond to that.